Good morning, everyone, and welcome to our Facebook Live in DuPont Circle at 1630 Connecticut Avenue. We're here in our nation's capital this morning, and I'm joined this morning with one of our longtime employees, Sean O'Neill, to be a guest interviewer with me. Sean, could you introduce yourself real quick?
Good morning. My name is Sean O'Neill. I'm the Senior Vice President here at Comfort One Shoes, and I've worked here with the Breton family for the last 24 years.
Excellent. So glad that you could join us. And we are working today chatting with Dr. Ravick of George Washington Medical Faculty Associates. And I'm going to flip that camera around. Good morning, Dr. Ravick. How are you today?
I'm good. Thank you for having me.
Could you take a moment to introduce yourself, please?
Yes, I'm Dr. Arnold Ravick. I'm a practicing podiatric physician with George Washington University Medical Faculty Associates, where I'm a associate clinical professor of surgery.
Excellent. And I know the two of you have been working together in cahoots, as it were, for quite a while. How did you two start working together?
Well, from my recollection, which it's been a while, I met one of the Bretons at a health fair many years ago, probably 20 or 24 years ago, and started working with the group. I'm very interested in shoes, obviously, and I did a health fair with them, and I did some training for the staff and so forth, and that's how I met Sean, and we've been working together ever since.
Excellent.
Dr. Ravick has been a huge help when we've had those foot ailments that are just a little beyond our scope. He's been a mentor and a good friend as well.
Yeah, so I imagine, Dr. Ravick, a lot of times you have patients who come in that you can send our way because, you know, you have recommendations for what they should be wearing on their feet to help with their issues. And Sean, how often do you have people that you send his direction because they don't realize they need medical help?
He's an important part of our business.
Well, I'm really glad that you can be here this morning. Sean, do you want to take it away with the questions?
Sure. Dr. Ravick, what are the most common foot problems that you see?
The most common thing we see is plantar fasciitis, but we also see lots of other issues, which would be bunion deformities, of which there are several different types, one near the big toe, one near the small toe, which is called a Taylor's bunion. We have hammer toe deformities, toenail issues, which could be ingrown toenails or just colored toenails, and then also neuromas, which could be pinched nerves in the front of the foot.
Dr. Ravick, plantar fasciitis is absolutely the foot trouble that we hear the most of. Could you expand on that a little bit more?
It's the most common thing we see as well. It's probably affecting about 25% of the population. And it's caused by many factors, generally lack of support or overuse. A lot of people think it's because people gain weight or different factors that could be involved, but we really not found that. You see people all different shapes and sizes with it. The plantar fascia is a band of tendons that is on the bottom of the foot, which forms your arch, which get too tight generally. The tightness leads to pulling away at the bone. That's why it hurts a lot when you get up in the morning or when you exercise vigorously.
Now, is plantar fasciitis one of those things that, you know, creeps up on you over time, or is it something that, you know, something happens and then now you have plantar fasciitis?
It could be some of either. Most commonly, I'd say it's more of a chronic, builds up over time issue. Most people notice they'll have a little bit of heel pain, or they'll stand in the shower on a hard surface, it'll hurt, and they don't really pay much attention, and then it gets really bad. But you can get some people where it's acute, where they're running down the field and it really starts to hurt and it pulls away aggressively. So you get both.
Okay.
Have you ever found a shoe that you've come across that you found to be a cure-all for all foot-related ills?
The short answer is no. There is no perfect shoe.
What?
As there is no common type of foot. It depends on your foot type and the way you walk. And that's where a place like Comfort One, it's expert in fitting and recommending appropriate shoes really comes in handy because they need advice. And people don't really know what to look for, and they often mistake lack of support for comfort, and that can lead to problems.
Right. And if we only sold one perfect shoe, Sean, we wouldn't be selling that many pairs of shoes. So that works for us.
So those problems are caused by a poor choice in footwear. Are there bad shoes?
I don't think that most of the problems are caused by a bad choice in footwear. They get exacerbated, I would say, by poor choices. sometimes bad footwear can lead to a problem. Yes, I think there are bad shoes that lack support, they're overly flexible and have very little control of the way the foot functions.
From a podiatric perspective, what makes a good shoe?
I think several factors. One is the back of the heel should be very strong. It's called the counter. I can demonstrate. Here's an athletic shoe. A good counter is a strong back of the heel. You want a good shank, which is the midfoot should be also sturdy. And then you want the front of the foot to be flexible and have a good and wide enough toe box.
Oh, okay.
I know for a fact you are a Hoka wearer.
Yes.
Is it a brand that you would recommend?
Yes, we recommend Hoka athletic shoes a lot. They have many different types. They're more supportive, less supportive, all-terrain, waterproof. That's what you want in a brand, in addition to comfort.
Are there some other brands that you might recommend?
I like Mephisto shoe. It's a good dress shoe. We have one here that meets the criteria. We also recommended Harchis, which is another brand. It's more of a casual shoe generally, but again, they have the good support. I tell people you want a pillow top mattress. You want cushioning with good bones, which again, someone who's good at fitting and knowing the shoes they have in their store will know which ones would be appropriate, and often I refer to your expertise as well.
Thank you. So what are you wearing on your feet?
I have Echo boots on today because it's a snowy, cold day, and they're supportive, comfortable, and don't slip, which is important.
And the rest of your family, are they? Sean's seen one or two of them too.
Daughters like Birkenstocks. That's
okay.
a big hit. They got to be in white. I think that's the big thing now.
Oh, right.
They're much younger than I, so they like those. A Birkenstock is a good, comfortable, supportive shoe. I think even in a sandal, you want support, you want the control. But again, there's no one for everybody. Some people think they're too hard. Some people like, say, an Echo sandal. There are other types that are more comfortable. It really is a matter of choice, fit, appearance, but also what's good for your given foot type.
A question that comes up now during this pandemic, people are going barefoot at home a lot more. Any recommendations on that trouble?
Yeah, it's caused a lot of problems. We see a lot of plantar fasciitis because of lack of support. There's been an epidemic of toe fractures because people bump into things. My advice usually is if you're sitting around at your desk, say, or on the sofa binge watching, you don't have to wear shoes. But if you're going to get up and move about, especially like in the kitchen where you could drop something on your foot or you can bump into things, shoes are an important factor. You should wear shoes.
Absolutely. And I'm kind of worried about, all of these women who have been working from home going back to the office and immediately deciding to put their high heels on to go to work. Because finally I get to go out. I've got a reason to wear my heels. What's going to happen then?
Well, I think, and I've recommended this for years, but it's the same. It would be more for the pandemic.
Right.
You should break into them. I think you should vary your heels. One, you shouldn't wear the same shoe every day there's a lot of reasons. Two important ones are different pain from different shoes, so it varies by shoe, and it's hygienically better to alter your shoes every day.
Yeah.
But with the heels, you want to break into them. I tell them you should wear a higher heel, a lower heel, a flatter shoe. Vary the height because it won't take your Achilles tendon and make it tighter. There's a lot of issues with wearing constant heels.
Yeah.
Again, if you haven't worn them in a year, you got to learn to wear them again and break into them, which is what's going to happen. And hopefully soon when all of us get back to offices and work.
Yeah, I tried to put on a pair of 2-inch heeled boots to go out the other day, and it wasn't a good idea. So go slowly, like take a grocery store trip in your heels and then go back to your sneakers for a while.
Definitely.
Ease into it. I really want to thank you, Dr. Ravick, for your time today. Really enjoy working with you all these years, and hope we can continue to refer patients and customers to one another and get everybody walking well.
Definitely. Thank you for having me. Thanks for having me.
Have a great day.